Hey, mamas. Welcome to Modern Nurture, where mothers meet at the intersection of instincts and evidence. I'm your host, Jess, and I want all mamas to feel the empowerment that comes with letting science guide, but intuition drive. Today on the show, I had an awesome discussion with Amy Hughes. She is a doula, a mother, and a personal trainer, and she has worked with experts like a pelvic floor therapist, physical therapist, and her midwife and other coaches to develop a pregnancy protocol. So we talk about how to structure your workouts before you conceive, while you're pregnant, and postpartum. We had a wide-ranging conversation that even included tips on how to avoid tearing during labor and why you should keep your legs closed in the early postpartum weeks. And I know where your head's at on that one. You're probably wrong. So without further ado, here's my chat with Amy. Hello, Amy. Thanks so much for joining us.
Thank you so much for having me. I'm excited to be here.
Yes, I'm really excited. Today we're going to talk about fitness, specifically around prenatal, and we're also going to cover preconception and postpartum.
Yes.
So I'm super excited to dig into that. I heard of you or heard of your program through the ATG Coaches app. And so maybe we could start there. Can you tell me a little bit about how you found out about ATG, how you decided you wanted to build this program, and then, how you went about building it?
Yeah, so I found it because my husband, he does jiu-jitsu, and he hurt his back and was laid out and could not move. And the only thing that got him back was the ATG program. And he did it little by little, and I watched him go from laying on the ground to being able to sit for a little bit of time and then getting back to his sport. And when we got pregnant, I was sitting at a desk job. I worked at a pediatrician's office. And I would be like, okay, well, my knee kind of hurts. So he would change my program following the ATG principles because he became a coach after it changed his whole life pretty much. And he changed it throughout my whole pregnancy as I needed it to change. And I didn't have any pain, really, my whole pregnancy. And I was like, okay, women need to know about this. This is the most amazing thing. Because I talked to so many friends, and sciatica is really bad, which I actually had a little bit more this time because I got lazy with my movement, and I have a almost 30-pound toddler. So I would just be like, okay, fine, and pick her up from the side or something. And so I was like, okay, I have to get back to those main principles. And we had 2 years in between when this baby is going to be here. So it gave me the time to work with a pelvic floor therapist, which I cannot recommend more. My work as a birth and postpartum doula in the past, and then learning all of the ATG principles. So I put all of those together and talked with my midwife and created something that would change throughout the program so that as your belly's getting bigger, you've already made the compensations getting your back stronger, and everything in your back body can grow with you. And so you're not trying to play catch up. So that was kind of my goal and where it came from originally.
Awesome. I really want to get a pelvic floor physical therapist on here as soon as I can find one.
They are the best.
That's another one that a lot of women don't know about.
Yes. Well, and it's crazy because you hear that in Europe and all these other countries, it comes with your postpartum care.
Does it?
Yeah, they're like, of course, you get to go to a therapist after you've done something that's like the most demanding you can do, especially on your pelvic floor. And it's just comes with the primary care of having a baby. And here, they're like, oh, you pee a little? Oh, that's fine. I'm like, no, that can't be the answer.
It's not normal.
Exactly. And they make you feel like you shouldn't talk about it because it's just what happens and that's what you should expect. And I'm like, no, we should expect better. Our bodies were made to birth a baby.
I recently was digging into the book Woman Code by Elisa Vitti. And that came from me trying to get my period back after breastfeeding or while breastfeeding. And one concept that she talks about all the time is things that are common but not normal. So we think they're normal because they're so common. and we overlook them and we don't talk about them, but they're actually not normal and we can fix them.
Yes.
So that's been popping up all over.
Which
Cool.
is really exciting.
Yeah.
It's like we're not
So I want to
stuck.
dig into the pregnancy protocols.
Yes.
But it probably makes sense if we go in order, if we start with preconception. So maybe first, before we dig into anything, can you give like the broad strokes? You know, what are the key differences in your approach in those 3 phases? And, you know, the type of movements or, you know, certain things we should understand at a high level.
Yeah. So in the first trimester, you're going to have the most range of movement, but it's also hard because you could be hit with morning sickness. So I start everything with the basics that you would find in the 0 program of ATG, which if you can literally just walk backward for 10 minutes a day and that's all you can do while you're sick, you're still going to be making progress. So I start everyone with that starting out. And then things like tib raises and calf raises so that your body is getting stronger from the bottom and everything is going to be like connected as you're going to be gaining the weight through the other trimesters. And I think squatting is so important for every trimester. And I start the first trimester, unless you are already in it, I give options to lift weights, but a lot of it starts with body weight and just seeing how you feel. And if that feels great, then you can move up. If that's too much, I have regressions as well. So everything can be supported. Everything is going to be hitting the long range and the short range. So we're hitting everything from head to toe, pretty much, and building that foundation for a lot of back support. Because as your belly goes out forward, it's hard to make those compensations and not turn forward. And so we do a lot of lifting over our back and making sure that everything up here is being pulled in the opposite direction. So the first trimester is setting you up to have better, as I'm sitting like this, with my belly. I just saw myself.
So what about before you conceive? What would you focus on there?
Yeah. Well, I would work on as much of like the cardio you can get, not even just running, but if you could do weighted backward and that's all you can do. Pushing a sled is phenomenal. Just getting out there, because what's crazy is we know that half of it is from us and half of it is from our husband. So they should be thinking about these things too. But on our side, it's like minerals are really important and making sure that you have that side. But then preparing with the squats, like everything you want head to toe to set yourself up as good as you can. And so if you can get out there and move your body, you're going to turn on some really good genetics that you have for your baby. So you want to be as physically active, as healthy, eating well that you can, because it's going to take, some stressors off your body when you do get pregnant and set you up better for maybe less fatigue, which if anyone has had a baby, they know that there's really not too much you can do. But if you can at least go in with a strong body, then you aren't trying to work yourself out of a hole. So I just think nutrition, including minerals, and getting your body as like strong and in tune with one another, and working on your pelvic floor before you get pregnant. So that was something.
Yeah, we can get into that too, like some details.
Okay.
And then just while we're talking high level, I think we're going to talk about postpartum too. Mm-hmm. What's your like high level takeaways for postpartum?
Be a mermaid for the first 2 weeks. Keep your legs together, because that
really.
Oh my gosh, yes. And that was like one of the things I always told my clients. And when I had my first baby, I hit 2 weeks and I was like, okay, I'm feeling pretty good. And so we went on a walk. I did not hold my baby on the walk because I was like, I know better. I won't hold my baby. No, my bleeding came back pretty strong. And so your body will tell you. So if you're doing too much, your body's going to be like, hey, this is important. Like, pay attention to me. But at least those first 2 weeks, if you can, as much as possible, keep your legs together It's going to help for the long run, especially later down the road when incontinence things start to come up. Then you're going to already set yourself up way better than if you're just getting down and doing everything yourself.
All right, I am super curious about what closing your legs has to do with keeping healthy postpartum. So I'll save that for getting deep into that discussion. I do think it's so easy for some of us to overdo it postpartum, though. I remember the day after I had my daughter, I felt normal. Like, I was like, I feel great. I can do everything. And I was just going. And then it all hit. And I couldn't move for 3 more weeks.
Yes. Well, it's crazy because if you think about it, your placenta itself has to come off the wall of your uterus. And yes, it's shrinking, but there is a wound that it leaves. And so it has to shrink down until you don't have a wound inside of you. So it's like, even if on the outside, say you didn't tear, say you didn't have anything out of the ordinary happen during your labor, inside your body's like, yo, we just grew this person, got them out of your body, and now you're like, oh, I can just go and get a coffee down the street. I'm like, no, your friend can bring it to you if you need that coffee. So yeah, I think it's really hard that, one, I know it's really hard if you don't have family nearby, and I know a lot of people don't, and I'm lucky that I have sister and my mom close by, so that is helpful. But as much as you can, you just have to give yourself the grace that you gave yourself when you were sick in the first trimester. So it's like, you don't have the nausea, but you are adjusting to, if you choose to breastfeed, you're adjusting to very little sleep. Your hormones on the 4th to 8th day, which might be when you started to feel like, whoa, what happened to me, plummet the lowest that they'll ever hit in your lifetime. So you go from the highest oxytocin and the highest endorphins you'll ever get, pushing that baby out. 4 days later, you hit the lowest you'll ever. So
that explains my situation.
So, and if you don't know, then there's really you think, is something wrong with me? And people show the highlights on social media, or people don't like to talk about, or we forget a lot of the things. And it's just no, you're normal for needing to rest. And it's actually really good and really important. And you should feel like you have enough value that you deserve to rest after doing the amazing feat that your body just did for 9+ months.
Yeah. All right. Let's just dig into the details now. So let's start with preconception.
Okay.
You mentioned nutrition and kind of preparing yourself for carrying this baby for 9 months.
Yes.
So where do you start?
Yeah. Well, if there is anything you can do, say you've never worked out, you've never done anything, walk. It's as simple as that. And if you can add some backward walking in, just to work both sides that get kind of underdeveloped, that's
so backward walking is a big pillar of ATG. Can you explain the benefits of that?
Well, what's so cool is kind of a tangent, but we have so many, this isn't cool, but it gets cooler.
Okay.
So many knee replacements in the US. They are some of the highest rates around the world. And then you go somewhere over into China or Japan, and you have all of these older people who have been walking backward for forever, and they have some of the lowest rates. So it's okay, well, we're constantly pushing everything forward into our body, always doing the deceleration, never working the opposite. And so it's kind of if you have a rubber band and you're running against it in one way, eventually it's going to snap because you're not ever giving it any sort of relief. So being able to turn around and do the exact opposite that we've been doing since we were kids, which is funny because my daughter now actually just will walk backward out of a room. I'm like, oh, practicing your backward walking, I see. And so it's something that we forget, our whole back body, because I think we're so focused with the next thing and going forward, and it's okay, but we need the balance of being able to like be introspective and look into our bodies and give ourselves a little break. And I think it kind of goes hand in hand with how like Americans do a lot of things. It's like, no, no,
Yes.
no, I can't stop and I can't like reverse. I have to keep going. And our body's like, hey, if you actually give like some back to us and put some like love and care into the other side of your body, then we're going to be able to keep going longer and stronger. And so, why would you use one half of your body and expect it to the other half to not like
So it brings a
degrade?
lot of strength to your feet in a way that you're not used to,
Your
and kind of the other side of
knees.
your knees.
Yeah. And I mean, it feels so nice too. Because you're just like,
Yep.
okay.
You just have to watch where you're going.
Yes. Yeah, I've run into
All
it a
right.
couple
So
times.
backwards walking. Anything else in the preconception phase?
If you can find something that for minerals that can help, because about 10%, you lose about 10% of your minerals per pregnancy. And so you have 4 kids, that could be about 40%. And it takes a long time to get it back. So if you can figure out a way, like I personally used, it's called Shilajit, and it's like a rock secretion, comes from the Himalayas. And so I started taking that just to make sure that I was building up my mineral count before it started to deplete. So if you can find a solution like that that has a lot of minerals, that's going to help you moving in. One, it helps with fertility, it helps with your energy, your mind, which, as you know, you've had a baby, kind of struggles a little bit as you go
Yes.
through pregnancy. So all of those things, you really want to, and those are just the basic is if you've never done anything, like eating less anti-inflammatory foods if you're having trouble conceiving can be really helpful. And just making sure that you are keeping your stress down, sleeping as much as possible, and prioritizing. I know I keep saying it, but it's like literally everything as a whole. You have to look at the whole thing as it's not just your reproductive system that's at work. It's like everything works systemically. So you have to, as much as you can, like nourish each part of your body.
What do you, what advice do you have for people that already have a good established workout routine? Do you advise them to change anything?
It depends upon, I think if you have like a good mentality with it, that's you're doing it for your body. If it's like a punishment sort of thing, which I used to have, and so I would get really down, and I was like this more with my first. I would get really down on myself if I didn't do it because I was like, I should be able to do it at all times. If I miss it, then that's like not acceptable. So, really checking the mental side that goes with it, I think can make a big impact as well.
Okay. Anything else we're missing from that phase?
Um, just get your husbands on board to take care of their side too.
What's the biggest advice you have for them?
um, I think one thing that can help motivate them is it's literally like their biggest input into the whole process. So it's something that they can actually do to be involved in it. And I know that a lot of husbands end up watching and they feel kind of disconnected. And if you can show them, like, hey, this is really important, excuse me, and this will make a difference for the whole life of our child, then it gives them something to motivate them to be like, okay, well, this is where I'm important. Like, I can actually help. And then they just become the supportive role once you're pregnant with the baby.
Yeah.
So it's like their time to shine in the whole
Yes.
process.
That's a really good way to frame it. That's definitely like they feel like they need to show up for one day.
Exactly.
So it's like, no, you need to prepare yourself a little bit for this.
Yes. Yeah, it's so important.
Okay, do you want to move into prenatal?
Oh, sure. Sure.
All right, so first trimester, a lot of nausea, a lot of exhaustion.
Yeah. How was yours?
What-
Just out of curiosity.
Mine was tough. I had a lot of bleeding, which was really scary. So I had to be really careful. And do you hear my daughter in the background?
A little bit.
Yeah, give me 1 second. I'm sorry about that.
Oh, my word. I totally understand. There's no problem on this end.
Okay, so where were we? Can we talk about the prenatal phase? What's important in the first trimester?
Yeah, so this is where it can be a little bit difficult because it's so individualized. So someone like you that you said you had a lot of bleeding, you have to be even more aware. But it's kind of cool because it makes you really have to check in with your body and listen to what it's telling you. So that's one thing that I am like, okay, listen, your body will tell you if something is okay or if it is not. So for you, your body was like, hey, no, yeah, we are literally giving you this bleeding signal that's like, hey, this is too much for us right now. Like, we need you to step back. For me, if I got hot, pretty much at all, I was like, So I had to just work out in my house in the air conditioning. And so if I went beyond that, my body was like, hey, So there were days where I could do a full workout, and there were days where I literally just walked backward for 10 minutes. And maybe I broke it up in 5-minute increments. And just learning to give myself the grace, it's like, okay, you are providing an environment for a baby to grow and thrive. So whatever that looks like, it's going to be different every day. So as you're going through it, just reminding yourself, like, today, maybe I can do half of the workout. Like, great. Maybe tomorrow you do more. Maybe you walk backward for 5 minutes. Whatever it is, like, give yourself the grace and just keep going. So just because it's hard or one day looks different than what you expected out of yourself, don't let that stop you. So just keep moving forward. Even if for, the first however many weeks, you just show up and you can do stretches and walking backward. It's going to make a difference. Your body's going to be so thankful that you're just like putting some love back into it. And if you're feeling great, like say you were feeling kind of terrible for a week and then you have a week and you feel wonderful and your body's like, let's do this. Then push yourself a little bit harder and it will be okay. And then the next day, you can assess how you feel and go from there. So you can do anything assisted, so squats.
Yeah, so I guess in terms of the movements, what are like the key movements that you have your clients do?
Yeah.
And what benefits do they have?
Yeah, so I really think that squats, my holy grail of everything for preparing yourself for all of all of pregnancy, and labor. So if you can train your body to hold yourself up and support yourself in like a deep full squat position, it's also going to help your pelvic floor. It's because it's going to teach it that it can open, that it can be supported with musculature in that area and give you some strength to stay there for longer than a second so you won't wear yourself out as much. So a lot of times I just say try body weight, and if you can't go all the way down, great, grab a chair. Go as far as you can, put your hand on the chair. Just getting your body used to that motion is going to make it so that you can gradually progress. And then a lot of things that help are things like elephant walks. You put your hands on the ground or a block and just straighten out one leg at a time, because especially the way that we sit a lot, it's going to help with, as things loosen up, you're going to have some more power and control in that area. And it's just going to be a lot. It will loosen in a way that isn't going to feel out of control as the relaxant's being released into your body. And back extensions, any seated good mornings that you can work on, just giving yourself a fully strong back that can compensate for the weight that's going to be coming in the front. one thing I didn't expect with my second was my daughter was breech until we had her flipped by a midwife.
I had the same thing with my first.
Really?
Yeah. Yes. We had to do the ECV week 37 or something.
So we have this magical midwife in Portland, and her name is Mary Grabowska. And I was like, please don't retire until my sister and I are done having babies, because she slipped both of our babies. And she is a midwife and an acupuncturist. And she stuck little needles in our baby toes. And in 10 seconds, she had my baby flipped head down. And
what?
Yeah, I was like, you are a magical woman, and everyone needs a Mary in their life. So,
wow, I had to go in, get pumped full of some medicine, which I forget what it was called, but it relaxed my uterus. And then lay on a table and have her manhandle me for 5 minutes or a little more.
Oof, Damaya. Yeah, I've heard a lot about ECVs, and I was like, sounds painful. My second baby is head down, so I didn't expect as much of the pressure of everything down and forward. And that is something that I wasn't as stringent about this time around, just making sure that I was doing all of the back body exercises in the first, because it gets a little bit more difficult when you have a tiny human to run after. And that's something with our next that I will make sure I prioritize. So making sure you can really build everything on the back side of your body so that you can compensate for however your belly grows. Because with my daughter, it was like up here and it didn't feel any different. But this time it's like way lower. And I was like, oh, that makes a big difference. So
that's a really good thing for me to know too.
Yeah.
Because that was my experience
with
the
the
first
carried
one.
high.
Yeah.
Yeah. So
good to know.
Oh my goodness. I can't stress doing anything that can help build the backside of your body to prep for any growth that's going to happen in the front. So that's my first trimester spiel.
Oh, okay. Is there anything about any signs of overexertion or things like that we should be worried about?
Dizziness, nausea, bleeding, cramping, anything that if you're doing it, you just have that feeling, because we all get that feeling that's like, I mean, I could push through it. But when you're in that first trimester, that's your sign to go, okay, but I don't have to.
Just don't do it.
Just don't do it. So just really tune into your body. And if it's giving you anything that's like getting that feeling in like your chest or your belly or wherever it is that you feel it in your body, your shoulders, listen to that and just say, okay, that's enough for today. But a lot of the things that will come are the nausea, the dizziness, the any sort of bleeding or cramping. Those are very common that will show up.
All right, let's talk about trimester 2.
My favorite trimester. I think most
people full of energy.
Yeah, it feels so nice. And it's like you're not too big in the second trimester, but you finally look like you're pregnant and can start to feel the baby, and you have that good energy. And hopefully a lot of the nausea has subsided. So this trimester is where I'm like, if you can, add some weights, and because you've been building a base, so just see how your body adjusts to it, and you can kind of push it a little bit harder, as long as you don't have anything that you and your doctors are watching. Like, as long as you don't have bleeding that has been going continually and hasn't resolved. Something like that. Outside of that, like, your body was made to move, was made to do exercises. It's going to help you feel so much better. And so much is psychological in pregnancy as well, that we think like our body's changing. And I'm like, yes, but your hormones are changing at a rapid pace. And you're thinking, okay, I don't have to just think about myself. I have to think about this new little person. And so there's a lot going on. So moving your body is going to just help you in your mind, your spirit, everything is going to just feel so much better. So
is there more of a focus on cardio here and is not really just balance?
Well, I really love pushing it a little bit harder if you have access to a sled, or if you have um, bands that you can put a kettlebell on or something. Just really pushing that so that you can get more out of breath and get that feeling. Because this is where you have the energy to do it. You still have really good balance, and you can push it a little bit harder than you can in the other two trimesters. So, more weights. And you don't have to, like, I am not a runner. I've never been a runner. I told my husband, if I'm running, then there's a problem and you should come find me.
I am with you.
Yeah,
100%.
the one time I tried running since we've been married, my husband literally called me on the phone and was like, "What is happening?" And I was like, "I'm not okay." So I am not a runner. So I would much rather add the weights and get the cardio boost in that way than to try to become something I'm not. And that's another thing.
Yeah,
Like,
I
if
get
there's
it.
something you hate, like, just don't do it. If if it's gonna make you dread it every time, there are other options. So if there's one
I found
movement, it's
a
like, oof.
bar, a prenatal bar program,
Oh,
and
nice.
that was really good, kind of the cardio that I needed.
Yeah. Bar is a lot harder than I thought it was going to be before I ever tried it. It was
It doesn't look that hard.
surprising.
It's not big movements.
No. Yeah. So, yeah. So you can find something that works for your body and that you enjoy, as you did. And so, again, I continue a lot of the same sort of movements. It's just higher volume, higher weight. Continue the squats. My favorite for like the back body is the seated good morning. And as your belly gets bigger, you just can move off the edge of a bench so that your belly goes below, or else your range of motion will
Yeah,
be like,
you'll just run into it.
mm-hmm.
Yeah.
So everything can be changed as your body is changing. And what's nice is I gave those options visually in the program that I created. That's like, hey, if your belly is hitting, you can do this. If it's harder for you, you can put the bench up so that you don't have to go as far. So, in both directions. And there isn't one place that you should be at. So, it's whatever feels good in your body, because we're all different and we're all coming with different backgrounds. So, just getting out there, I know that exercise can be really intimidating and can bring a lot of feelings of shame for a lot of people. And so just knowing, like, just showing up is something that you should applaud. Just trying and moving your body in some way is going to be beneficial. And if you can build some muscle around the way that your body is changing, then that's important too. Another thing to remember is your relaxin is really starting to pick up in the second trimester. So all of a sudden, you may be doing some split squats or squats, and you can go way deeper. But you really need to be aware of your body if that like feels good or if it's starting to feel a little achy, because relaxing can allow you to get into that position, but it might not have the muscles around it to do it safely. So go slow with like the changes you're making. We want you to progress, but if all of a sudden you're going 4 inches deeper, kind of reevaluate and see how your body feels the next day.
Can you talk about how relaxin changes over the three trimesters?
Yeah, so it starts to pick up in the first trimester, but it's not making a lot of change. And then in the second, it starts to make a lot more change so that everything can expand out. And then by the time you get to the third trimester, it's really opening up your pelvis. So your hips will start to feel looser. Your ligaments that are holding your belly up will start to feel like they've kind of become a little bit more wobbly. And that's literally so that you can birth a child. Because if we always walked around with that, like, we wouldn't be very well supported. But it's so incredible because it moves throughout it in such a way that it's strong enough to hold it up and it's strong enough to release a baby out. So by the time you have like labor starts, the relaxant is enough that instead of just holding your pelvic girdle like this, it can open like this. And that's loosening all of the ligaments that have been holding you together and holding everything secure so that that baby can make its way out the um pregnancy brain is real.
Oh, trust me, I get it.
Like, oh
I
my
lost
word.
my keys in the refrigerator once.
I've put some things in the pantry that I'm like, that is bad now. That does not go there. Oh my word. So your pelvis has to be able to adjust to that change. And then it's important to know it takes 9 months for that same relaxant to go back to your pre-pregnancy amount. So,
Do you know if that's true for breastfeeding moms? Because I just read something yesterday that said that relaxin stays high for the entirety of breastfeeding, which blew my mind if that's true.
Ooh, okay, well, I have to look into that because I have not read that.
Yeah, I haven't either. I haven't
interesting.
verified that, so
Yeah.
definitely need to check it.
That's really interesting. So
Yeah.
at least 9 months, if not 2 years.
Crazy. That was really surprising to me. But I had a back injury recently, and it was really strange. It came out of nowhere, and I was like, why? Because, like, I haven't changed my workout habits. I haven't changed anything. And then I read that, and I was like, I wonder.
Yeah, that's so interesting. I've got to look that up. Like, it would make a
So,
lot of sense.
one thing that we want to try to do during pregnancy is strengthen the pelvic floor. So it sounds like the squats are the focus for you of how you build that.
I do that with squats, but I also do it with breathing in cat-cow, breathing on my back with little bridges, keeping my whole body on the ground with my feet up against the wall. So there are a lot of really simple movements that you can work your breathing to.
So how are you supposed to breathe in cat-cow?
Yeah.
Because I've seen it different ways.
Yeah.
And I never know which way to inhale on.
Yes. Well, the thing about it is a lot of times I have to redo it as well while I'm doing it, and I'm like, okay. So, you breathe in when you are doing the cow, and then when you breathe out, and you have to like release your bottom in it if you're doing it for the pelvic floor. So a lot of times when they're doing it, they're not specifically doing it for the pelvic floor. So in this way, you breathe in while you're doing it that way, and then when you're turning into the cat, you want to pull up like you're sipping a really thick smoothie up through your vagina. And so it's not like a pinchy feel, which I feel a lot of us were taught like that's what Kegels are. So it's not doing a Kegel. It's like a full smoothie that you want to like bring everything in, and you want to bring up your pelvic floor, your abs in, and your ribs in. So I always had my ribs extended, and I just thought, oh, since I was a kid. And then I realized by going to a pelvic floor therapist that my core has never been connected, even as a child. So I may not have had the symptoms, but I had a nice setup for after birth being like, oh, there's definitely a problem. And my problem was I kept everything so tight that I had to learn to relax. And that is why I was like, okay, I feel like after I had my baby, I'm like, oh my gosh, I have to pee right now. And there's like no more tightening. And so I was on the outside of it, which I didn't even know was a thing. So I had to learn how to release everything and then re-engage it. So
interesting.
The rib
I didn't know that there was a specific way to do cat-cow to engage the pelvic floor. Recently, in the ATG women's thread, they talked about a paper that showed exercises that had, comparing to Kegels, the biggest impact on pelvic floor, and cat-cow was one of them.
Yeah, it surprised me when I was doing it in my pelvic floor therapy. I was like, okay, I never did this correctly.
Yeah. All right, so second trimester is up the intensity, try to load. Anything else before we move on?
just like we were just talking about, really going after that pelvic floor exercises. And then you can bring that breathing into any sort of exercise. And you can practice it while you're doing dishes. So I would
Yeah.
stand at the counter and just like work on releasing and engaging everything. Or my daughter has one of those fake tissue boxes. And
Mm-hmm.
she thought it was hilarious if I just like put it on my face and would blow it out. So I would just do my breathing when laying on my back doing that. And she thought it was so fun. And I was like, oh, I'm actually getting better at my breathing. So just
Nice.
incorporating it whenever you can is just going
Yeah.
to help so that when you're doing all of the different movements with weights, you're actually engaging everything correctly.
Having a toddler does really give you more excuses to move and, get various types of exercises.
Yes. Yeah, and I have incorporated a lot more crawling this time, which I think has helped with his positioning. Because it just kind of creates that space and kind of encourages his back to be toward my belly. And
Crawling
he's
on your
on
hands and knees or like your feet?
hands and knees.
Hmm.
So as much as I
Interesting.
can when I'm playing with her, I crawl. I crawl all around my house.
That's funny. I've stumbled upon crawling as well,
Yeah.
but it was more of the postpartum thing where I found it.
Yeah.
So I'll definitely keep doing that
Yes. It's super
for my next
helpful.
one as well.
Yeah.
All right. So I guess third trimester then.
So third trimester, you might get some of those symptoms again. You might get a little bit nauseous. You might get some of your tired feelings back. You may feel just as great as you did in your second trimester for a long period of time. And so if it feels good to add the weight, great. If you're kind of feeling like things are a little too loose and your balance isn't as great, which is very common, then maybe just take some of the weight off. It's a lot of the same movements, just not as intense. So it's a little bit less repetition, a little bit less weight, and a lot of that pelvic floor work. That's
Is there
gonna help you
anything
get through.
specific for labor or the muscles required for labor that you start adding in the third trimester?
So
Trimester.
So it isn't anything else outside of what I've been doing because I wanted to add it in from the very beginning. So a lot of just even just couch stretches that's going to keep everything loose in that area and being able to
So couch stretch is when you're doing the hamstrings.
Yes.
Sorry, quads.
Quads up against the wall.
Yeah.
Or against a couch if that is easier for you, or on a bench with an incline. You can also do it like that if everything is too tight. So a lot of things, you just want to make sure that you aren't going into labor with everything so tight because you're already going to have to work against your body contracting on its own. So you want to be able to be in these uncomfortable positions and really breathe through it and relax into those positions. So a lot of the stretching, just as much as you can, breathe into it, relax into it, and try to feel as comfortable as you can because that's going to help a lot when you do go into labor. So
yeah, that's similar to the program that I found when I was first pregnant with my daughter. There was a lot of in the third trimester holding squats or holding, like a goddess kind of pose, and then just breathing there.
Yeah.
Or just like some kind of pulsing exercises and just breathing.
Yeah.
So I think that probably helped me a lot. I think I pushed for 20 minutes or less.
That's so nice.
We had a super fast one, super
Yeah.
fast.
Yeah, I had about an hour of pushing, but I was very adamant. I did not want to tear, and so I told my midwife, I was like, I do not want to sacrifice my perineum. So when that crowning happens, I need you to like help me slow down. And she did, and I got to the point. And the only way I can explain it is, you want to either pop that head back in or just like push it out. And I was like, okay, but I know that this will help in the end if I can just leave it. And it went really well.
Oh, geez.
Yeah.
That was the part that I felt the least prepared for.
Really?
The final pushing part. Because, I don't know, I labored at home. I didn't realize I was in labor for the longest time. It was not until it was painfully obvious that I needed to get to the hospital. And then, I get there and the nurse gave me some advice for pushing and I feel like it was wrong. And so I tried the first one and she's like, no, 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 no.
Yeah.
Because I like popped blood vessels in my face because I was trying to follow what she said.
Was it like the breath hold
Anyway.
and the count?
Yeah, she was like, I don't even remember the advice, but it made me feel like I needed to take a very deep breath and then very like push everything as hard as I could. And that was not correct.
Yeah.
I don't know. This is a thing I need to research for the next one.
Yeah. What position
I still don't know.
push in?
I was on my back.
Okay. Yeah. So I did sideline because it can take a lot of pressure off of your, off your tailbone and your perineum. And I had them hold my knees in because knees in, feet out opens up that last side of the pelvis. So when you're in labor, you want your knees out and your feet in so that the baby can engage into your pelvis. And as you're moving through it, you want to switch. So with pushing, if your knees are going in, your pelvis is actually like this. So it's opening up the outlet so that they can get down.
Interesting.
And not that you asked for this.
No, that's great.
But
I want this. I know it's off topic, but I need to know this.
It does create that space that allows the baby to come through without having to really work as hard because it actually gives them the open space. And then I told them I did not want them to coach me when I was pushing. And I told them, I was like, if I'm really wrong, then tell me. But I was never really wrong. Like, my body was like, okay, push until I was like, mm-mm. And then when I started the crowning, I would push a little bit. And then my midwife told me, she was like, okay, now just like kind of go. And that allowed for the expansion. So you just want to push enough so that the baby's head can push a little bit further and then kind of rest. And that's going to help with the tearing as well. I don't know if you had any tears, but
I did.
Yeah, so that will help being able to kind of get it to open up slowly without it being like, okay, and here's all the pressure at once. But your body.
This is another one of those things where if you just listen to your own body, you can probably have the best outcome.
Yeah.
Just like taking care of your baby, typically.
Yes.
Listen to yourself, listen to them.
Yeah.
That's a big thing I learned.
Yeah, it's funny because working as a birth and postpartum doula, there were some things I was like, yep, that wasn't the greatest advice because you don't know until you know.
Yeah.
And some of it really is just like, okay, well, what do you feel is the truth? That's like the quiet voice. Because sometimes when you start to be like, okay, well, maybe I should do this, and there's something that is smaller, and you're like, okay, that's usually the voice to listen to. That's like, this isn't panic, this isn't fear. Like, this is what your baby needs, and your body is really smart. We think like, okay, we can grow the person, get them on the outside, and then we don't know anything. But it's like, no, there's a lot that you do know. So listening to that is...
Yeah, exactly.
It's hard sometimes, though.
Was there anything else on the third trimester we should touch on? One thing that we haven't talked about is like a dosage. Do you recommend 30 minutes a day or 30 minutes 3 days a week or 5 minutes every day?
Yeah. So I tested this out with probably 12 to 14 ATG coaches with their pregnant clients before I put it out. And originally I did it in larger doses 3 days a week because I was like, okay, well, maybe that is more adaptable for people's lives. And I kept hearing that with their pregnant clients, they had a hard time because of the days that they aren't feeling well, of the times that they have a toddler who's screaming at them, when it just doesn't work with their schedule. So I dosed it down to more weights 3 days a week and then more of the stretching in the pelvic floor 3 days a week. So I have it 6 days. So I've dosed it down but effectively.
Yeah.
And if you
I think
wanted,
we
you could
forget,
combine it.
we often do more than we need to. We feel like we need to do more than is actually necessary.
Yeah.
That's another thing I learned in the whole, trying to regulate my cycle after breastfeeding thing, is I was probably working out too much,
Yeah.
also not eating enough. Like I felt like I was probably just enough in balance to be sustaining my daughter and myself. But it was like my body was clearly, you're overdoing it.
Yeah.
You don't have enough nourishment to start the next part of your family.
Yes.
So there's a lot of balance to be had.
Well, that's where stress and rest comes in. So it's like maybe your body's telling you, like, no, don't do it. Listen to that. And that's okay. And give yourself the space to say, not today. Like,
Yeah.
it's okay. And maybe what you can do is while you're watching something, just do some cat cow. Do some of those like really small movements that you can still work on your breath work and your pelvic floor. And so then you're like, okay, I'm still making progress, but you don't have to go out and do 30 squats, So just giving yourself the space to feel out how you're feeling throughout pregnancy. Because it's literally the hardest thing that you can do for 9 months. Like the way that your body has to sustain itself is pretty incredible.
I had a couple more questions about prenatal, and then maybe we can run through postnatal quickly. So based on your experience, what are the most common injuries that you see during pregnancy or even at postpartum that we could probably train for?
Yeah. One of the biggest is sciatica related issues. I think a lot of women hit it and it comes out of nowhere and it hits really hard. And it's something that can feel so debilitating and can really take you out. And so once you start to feel the tinges of it, it's something that I'm like, okay, address it then. Don't wait until all of a sudden you're trying to crawl through your house because you can no longer stand. And part of that is just body mechanics, is making sure when you pick something up, you are not just bending down and picking like I did with my toddler and ended up getting sciatica in the first trimester.
Oh,
So,
geez.
yeah, but I had the tools to do couch stretch and do like the pigeon pose, which really opens up your hips and works into that back body, and elephant walks. And so I had the resources and I made a video and put it on my Instagram because I was like, anyone that has sciatica in pregnancy, like just please start here. So there are things that you can do to get out of it. And a lot of times they just say, ice it, which I'm like, because it just kind of stiffens everything up and might like numb you for a little bit, but you actually need like blood flow into that area. So a lot of the ways that they're telling pregnant women, I end up talking with them a lot. And I'm like, okay, I see that this is what you've been told. Maybe you could try this. Let me know how it feels and then come back to me. And
That's funny because my next question was, what's something you think most people get wrong about prenatal fitness? Seems like you encounter that a lot.
Yes. Well, and it's just like the completely stopping moving your body is not going to be helpful because you need to have blood flow through your whole entire body at all times, especially as it's changing and if there's an injury present that's not like, I broke my leg or something crazy that's going to hold you down like that. But healing comes from actually like warming the area and moving the area and using it in a pain-free way. So I think that is, and there are still doctors out there, not all of them, but there are still doctors out there that tell you, don't lift more than 10 pounds. And I'm like,
yeah,
I have a 30-pound toddler. What would you like me to do? Not lift her for 9 months? Like that isn't realistic. And it's not realistic for how your body actually adapts and is super strong and can thrive in pregnancy, and the way that weights actually can help you so much to feel so much better so that everything feels like a unit instead of like, oh, my hips feel like they're doing one thing and my back is doing one thing. It's like, no, it's so beneficial. Even if you're just doing body weight and that's all you can do, that's phenomenal. And
Yeah.
just move your body.
Are there any modes of exercising or like moves you think that are probably doing more harm than good in pregnancy?
I'm like, oof. This is where I could get myself in trouble. I think that there are some ways that people train where they're not being watched on or given advice on form and just kind of like thrown weights and doing it in a certain way that is like for reps so that you can get the most amount in the smallest amount of time. And I think that that is not very tuning into your body, but like tuning into a mindset that's kind of if you can like check out of your body. So anytime where it's not about like, okay, how does it feel? Let me fix this form. Make sure that you're doing it in a way that's going to be nourishing to your body is not super helpful.
Yeah, that's really a good thing to think about. That's a good thing to think about whether you're pregnant or not.
Yes.
But you are so much more prone to hurting yourself in
Yes.
pregnancy. So,
Yeah.
yeah, that's a good one. Okay, you want to move into postnatal?
Sure.
Look, I am still sitting here curious about the close your legs thing. What does that do for you?
Okay, so literally when you have your legs together, it's going to allow everything to heal. So every time you're opening it back up, your perineum, your labia, your pelvic floor, everything is having to be reused. But what it needs is rest for like at least those first 2 weeks. So the more you can keep your legs together, the less you're doing this, which is opening everything back up that's been through a lot of trauma in the past however many days, weeks. And so it's literally just comes back to rest and keeping everything as close as you can is going to allow all of that tissue to come back together in a better, quicker, less painful way and set you up for the rest of your postpartum. So at least 2 weeks. The more you can.
All right,
It's
that makes
literally
sense.
like, okay, just when you get out of bed, even like turning and keeping your legs together to the floor. Like little things like that will make a big difference. Not going up and down stairs. So anything that's going to
interesting.
open up that tissue is just going to take a longer time to heal on the other end of things.
Okay. So then once you are, so would you say no exercising? A lot of times they tell you 4 weeks, 6 weeks, something like that.
This is where it does get a little bit more individual. It can be longer than 6 weeks. Some people at 4 weeks feel great to start walking. I tried it early and my body was like, yo, no. And so you can try it and your body will let you know. I am more on the 6 week starting. And if you're going to be walking, don't even hold your baby. Because even that added weight of an 8, 7, 10-pound child will make a difference in the healing of your pelvic floor. So when you start it out, if you go in your garage, even if that's where you have the space to try, if you go on a walk out in the neighborhood, you have to do it when someone else can hold the baby so that you can see how your body is feeling. And then when you come home, you'll get
Pushing a stroller, is that too intense?
I mean, I wouldn't. It's much better than holding the baby itself. And some women would be like, are you kidding me? But I'm telling you, for the healing and the pelvic floor health, like it's really important.
So lay in bed with your baby on you as much as possible.
Yes, as much as you can. And then just try things really slowly. And so everybody's going to be a little bit different. And maybe at 4 weeks you feel great and you can go on a walk. I am not one of those people. My body was like,
when you do start to feel good, what kind of exercise protocol do you follow?
Yeah. I definitely start with no weights at all
Yep.
and simple things like the walking backward, the working on calves and tibs and working from the ground and kind of not addressing a ton in my core at the beginning, letting that like continue to stabilize a little bit more, and then doing lighter back extension and keep working because you're going to be nursing, you're going to be taking care of a baby, you're going to be in this position. So doing pullovers where you're bringing the weights behind you is just going to pull everything back. So again, I continue to address the back side of the body because even after pregnancy, even after that weight is not being pulled in that direction, your body's being pulled in that direction throughout the night. And everyone's like,
Yep.
well, you have to make sure at all times. I'm sorry, but there are times where you're just going to be so tired. You're not going to make sure that you are in the perfect position.
Perfect posture.
No, it's not realistic. So that's
You're
what
trying to
I
not
address.
fall asleep.
Exactly. I'm like, I don't want to drop the baby. So I need to
Yeah.
make sure that we're all like supported in some way, whatever that looks like. So I still continue addressing the back side of the body before I go. Like, I do not look at squats after I have the baby for a long time. And
And you don't do focused core for a while?
I only do like, what are they called? Oh my goodness. Bird dogs.
Bird dogs,
Bird
yes.
dogs. So something like that, and I'll start with my hands on the ground, and then I'll also do on my back like bridges, but I don't do anything that's like directly gonna go for my core straight away, just because I want to make sure I've got some other supports in the work. And once your body's starting to feel good, then go ahead and you can add that in and see how it works. I am just more on the slower to it side than probably a lot of people. A lot of people would probably be like, oh, you couldn't do that way before that. I'm just like, why? If I can strengthen a lot of other things and like do breath work to work on my core, then I would rather it take a little bit longer and just have more
So I was
secure
kind of like
results.
under the impression that your core is very weak after you give birth. So you need to start trying to build it so you're not out of balance in that way.
Yeah. Well, that's where I do it more with like the small movements and the breath work. And we do become unaware of how to re-engage our core, but also we have to make sure that we're doing it correctly, because we might just suck in the middle side of our belly and leave the bottom completely unattended. So as we're healing, it's like coming in at different degrees. So going really slow, making sure that you're engaging your lower abdominis, your middle, and your ribs. So it's like everything from your pelvic floor up to your ribs. And the breath work and relearning how to connect to that is going to make a bigger difference than like doing some big
Trying to do crunches or
abdominal
something.
exercise.
Yeah.
Because that's not going to connect at all. And a lot of times, I mean, I'm sure most women end up with like some sort of diastasis, so some separation of the abs. And that's where like learning how to put them back together and working with them coming in is more important than like building on top of it. Because if you're building muscle on top of it, then it's going to start at that like expanded state. And then you're going to eventually have to go back in and close it.
Got it. Okay. Yeah, definitely the biggest problem I had was knee pain. I never had any knee pain in my life. And then, 3-4 weeks in, I started having really bad knee pain. That's actually how I found out about ATG. So that's how I fixed myself.
Yeah. Did you start with like tib raises and calf raises and?
Yeah, I just did 0.
Yeah.
Except the split squat. I didn't feel like doing that.
Yeah. You're like, that's a lot.
Yeah. So I waited on that.
Yeah.
But yeah, I did everything else, I think, besides the split squats at the beginning.
Yeah. Oh yeah, that program is amazing.
It is. And a lot of people haven't heard of it. Do you have different recommendations for people that had a C-section? Or is it, I mean, they probably have to wait a little bit longer.
And
But then is the rebuild the same?
it's a lot of the same, like learning how to reconnect, because especially you've had, 6-ish layers that have been cut through. So you're going to have to relearn how to reconnect all of those muscles back together, so that's again where I'm like, going slow is better, because you're going to learn how to use your breath work, how to use your movement to connect all of that so that you can gain the strength over the top of it. And just paying attention to the incision site, because I know things rubbing on it can cause like irritation, or if it can go beyond that and like infection. So you just have to be extra aware of the incision itself, whatever that looks like. But as long as your body isn't yelling at you, then you're on the same sort of track.
Okay. We've been here for a while, and I know you're weeks away from having your little one, so you're probably ready to get up and move. Two last questions. One is, are there any emerging trends in, preconception, prenatal, or postnatal fitness that you're really excited about?
One is that this idea of trusting what your body's telling you. I think more people are tuning back into that and going into working out or whatever it is, whatever that stage is, health, like with eating or anything like that, is listening to what your body's giving back. So if you put something in and it comes back in a negative way, then readjusting and not trying to do something just because you should, but knowing that everyone's a little bit different. So if you have a workout one day and the next day your body is completely wrecked, readjusting and going from there, and not just saying like, oh, well, throw it all out, because that obviously isn't right for me. But readjusting and saying, okay, well, there's good in there, but how do I take that step back and doing it without pain, which is such a beautiful thing of ATG. That's like, you can do all these movements in a range without pain, and it's going to progress your body in such an amazing way. And I love that idea. It's like, yes, you can still do it. You can regress it. Just if it starts to hurt, that's your body like, yo, not ready for that.
But listen to yourself. That's a big one. So, Amy, thank you so much for being on the show. I had so much fun talking to you.
Thank you.
You put up with a lot of interruptions with my daughter, so I'm
no worries.
Really appreciate that. Where can people find you, and how can people work with you and find your program?
Yeah, so I have an Instagram account. That's pretty much where I do everything right now, especially because I'm really in baby and mommy mode. So a lot of the stuff I do is virtually. So it's __ Amy Hughes, HUGHES __. And there's a link in my bio to the pregnancy protocol, and you can reach out, ask me any questions. I'm happy to talk about all of the things that have to do with babies and pregnancy and any questions that you may have. And if you have questions about the protocol itself, I'm happy to talk about it there too. I'm not as active right now as I'm getting ready to have a baby, so
yes, you should definitely be not active.
So I will see it and I will answer it, but I'm not making a ton of content at the moment, because we were making it to on Sunday we will be 37 weeks, which get us into our home birth range, which makes me very excited.
Congratulations.
Thank you.
I might have to reach out and talk to you about that at some point, because that's a thing I've been considering too.
Oh my gosh, please do. I love it.
Awesome. All right. I'll leave a link to all of those things in the description of the show. Perfect. Thanks again.
Thank you.
Thank you for listening. I hope you enjoyed that conversation as much as I did. In this episode, we referenced ATG, Athletic Truth Group, and a lot of the exercises that they have in their programs. You can find a ton of free and valuable information on the Knees Over Toes Guy channel on YouTube. I'll have a link in the description if you would like to join the ATG app which will give you exercise protocols and access to coaches, which I found really valuable. The link is an affiliate link, which means that I will get a small commission if you do choose to sign up. No extra cost to you. Whether you decide to sign up for the app or just go down the YouTube rabbit hole, I highly recommend checking ATG out. It was their Zero program that helped me fix my knee pain that I developed postpartum. It helped me start to feel really strong and resilient. You might also have heard or seen me dealing with my 2.5-year-old daughter during that episode. So I apologize for that. She has not been napping this week. Something's going on. She needed a little extra attention. So hopefully I was able to edit most of that out. All right, mamas, you can follow me at Modern Nurture Pod on Instagram. You can get episode summaries and more on my website, modernnurturepod.com. And you can listen wherever podcasts are available. See you next time.